9 Absolutely evil medical experiments. Medical research saves lives, but sometimes scientists let the hope of a breakthrough get in the way of ethics. Recently, the United States government issued a formal apology to Guatemala for experiments done there in the 1940s that involved infecting prisoners and mental patients with syphilis. The Guatemala Project is just one of many terrible experiments done in the name of medicine. Some ethical lapses are mistakes done by people thinking they were doing the right thing. Other times, they're pure evil. Throughout our history, some medical research are plagued with ethical issues. The human test subjects are usually society's most vulnerable, and the doctors rarely have to answer for their horrific crimes. Here are 9 of the worst experiments on human subjects in history. Nazi medical experiments. Perhaps the most infamous evil experiments of all time were those carried out by Josef Mengele, an SS physician at Auschwitz. Mengele combed the incoming trains for twins upon which to experiment, hoping to prove his theories of the racial supremacy of Aryans. Many died in the process. He also collected the eyes of his dead patients, according to the US Holocaust Memorial Museum. The Nazis used prisoners to test treatments for infectious diseases and chemical warfare. Others were forced into freezing temperatures and low-pressure chambers for aviation experiments. Countless prisoners were subjected to experimental sterilization procedures. One woman had her breasts tied off with strings so SS doctors could see how long it took a baby to starve, according to an oral history collected by the Holocaust Museum. She eventually injected the child with a lethal dose of morphine to keep it from suffering longer. Some of the doctors responsible for these atrocities were later tried as war criminals, but Mengele escaped to South America. He later died in Brazil in 1979 of a stroke. Japan's Unit 731. Throughout the 1930s and 1940s, the Japanese Imperial Army conducted biological warfare and medical testing on civilians, mostly in China. The death toll of these brutal experiments is unknown, but as many as 200,000 may have died, according to a 1995 New York Times report. Among the atrocities were water wells infected with cholera and typhoid, and plague-ridden fleas spread across Chinese cities. Prisoners were marched in freezing weather and then experimented on to determine the best treatment for frostbite. Former members of the unit have told the media that prisoners were dosed with poison gas, put in pressure chambers until their eyes popped out, and even dissected while alive and conscious. After the war, the US government helped keep the experiments secret as part of a plan to make Japan a Cold War ally. The Monster Study. In 1939, speech pathologists at the University of Iowa set out to prove their theory that stuttering was a learned behavior caused by a child's anxiety about speaking. Unfortunately, the way they chose to go about this was to try to induce stuttering in orphans by telling them they were doomed to start stuttering in the future. The researchers sat down with children at the Ohio Soldiers and Sailors Orphans Home and told them they were showing signs of stuttering and shouldn't speak unless they could be sure that they would speak right. The experiment didn't induce stuttering, but it did make formerly normal children anxious, withdrawn and silent. Future Iowa pathology students dubbed the study the Monster Study. 3 surviving children and the estates of 3 others eventually sued Iowa and the university. In 2007, Iowa settled for a total of $925,000. The Burke and Hare murders. Until the 1830s, the only legally available bodies for dissection by anatomists were those of executed murderers. Executed murderers being a relative rarity, many anatomists took to buying bodies from grave robbers or doing the robbing themselves. Edinburgh boarding house owner William Hare and his friend William Burke took this entrepreneurial activity one step further. From 1827 to 1828, the 2 men murdered more than a dozen lodgers by suffocating the victims to death at their boarding house and sold their bodies to anatomist Robert Knox. Knox apparently didn't notice or didn't care that the bodies his newest suppliers were bringing him were suspiciously fresh. Burke was later hanged for his crimes, and the case spurred the British government to loosen the restrictions on dissection. Surgical experiments on slaves. The father of modern gynecology, J. Marion Sims, gained much of his fame by doing experimental surgeries, sometimes several per person, on slave women. Sims remains a controversial figure to this day, because the condition he was treating in the women, vesicovaginal fistula, caused terrible suffering. Women with fistulas, a tear between the vagina and bladder, were incontinent and were often rejected by society. Sims performed the surgeries without anesthesia, in part because anesthesia had only recently been discovered, and in part because Sims believed the operations were not painful enough to justify the trouble, as he said in an 1857 lecture. Arguments still rage as to whether Sims patients would have consented to the surgeries had they been entirely free to choose. Nonetheless, Sims manipulated the social institution of slavery to perform human experimentations, which by any standard is unacceptable. Guatemala syphilis study. Many people erroneously believe that the government deliberately infected the Tuskegee participants with syphilis, which was not the case. But the work of Wellesley College professor Susan Reverby recently exposed a time when U.S. Public Health Service researchers did just that. Between 1946 and 1948, Reverby found the U.S. and Guatemalan governments co-sponsored a study involving the deliberate infection of Guatemalan prisoners and mental asylum patients with syphilis. The study was intended to test chemicals to prevent the spread of the disease. The researchers attempted to infect their subjects both by paying for them to have sex with infected prostitutes, and by abrading the skin on their penises, and pouring cultured syphilis bacteria on the wounds. Those who got syphilis were given penicillin as a treatment. But the records she uncovered indicate no follow-up or informed consent by the participants. On October 1, 2010, Secretary of State Hillary Clinton and Health and Human Services Secretary Kathleen Sebelius issued a joint statement apologizing for the experiments. The Tuskegee study. The most famous lapse in medical ethics in the United States lasted for 40 years. In 1932, according to the Centers for Disease Control and Prevention, the U.S. Public Health Service launched a study on the health effects of untreated syphilis. Unfortunately for the unwitting participants in the Tuskegee experiments were told they were getting treatment from the U.S. Public Health Service. However, this study involved researching the effects of not treating syphilis on the human body. There's a good reason many African Americans are wary of the good intentions of government and the medical establishment. Even today, many believe the conspiracy theory that AIDS, which ravaged the African American community, both gay and straight, was created by the government to wipe out African Americans. What happened in Tuskegee, Alabama in 1932 is one explanation for these fears. At the time, treatments for syphilis, a sexually transmitted disease that causes pain, insanity and ultimately, death, were mostly toxic and ineffective. Things like mercury, which caused kidney failure, mouth ulcers, tooth loss, insanity, and death. Government-funded doctors decided it would be interesting to see if no treatment at all was better than the treatments they were using. So began the Tuskegee experiments. Over the course of the next 40 years, the Tuskegee study of untreated syphilis in a Negro male denied treatment to 399 syphilitic patients, most of them poor, black, illiterate sharecroppers. Even after penicillin emerged as an effective treatment in 1947, these patients, who were not told they had syphilis, but were informed they suffered from bad blood, were denied treatment or given fake placebo treatments. By the end of the study, in 1972, only 74 of the subjects were still alive. 28 patients died directly from syphilis, 100 died from complications related to syphilis, 40 of the patients' wives were infected with syphilis, and 19 children were born with congenital syphilis. The Aversion Project. They didn't like gay people in apartheid era South Africa, especially in the armed forces. How they got rid of them is shocking. Using army psychiatrists and military chaplains, who were presumably privy to private, confidential confessions, the apartheid regime flushed out homosexuals in the armed forces. But it did not evict them from the military. The homosexual undesirables were sent to a military hospital near Pretoria, to a place called Ward 22, which in itself sounds terrifying. There, between 1971 and 1989, many victims were submitted to chemical castrations and electric shock treatment, meant to cure them of their homosexual condition. As many as 900 homosexuals, mostly 16 to 24 years old who had been drafted and had not voluntarily joined the military, were subjected to forced sexual reassignment surgeries. Men were surgically turned into women against their will, then cast out into the world, the gender reassignment often incomplete, and without the means to pay for expensive hormones to maintain their new sexual identities. The head of this project, Dr. Aubrey Levine, went on to become a clinical professor at the University of Calgary. That is until 2010, when his license was suspended for making sexual advances towards a male student. He was sentenced to 5 years in prison for other sexual assaults against males. Agent Orange experiments. Prisoners have often been the unwilling objects of evil experiments. From 1965 to 1966, Dr. Albert Kligman, funded by Dow Chemical, Johnson & Johnson, and the US Army, conducted what was deemed dermatological research on approximately 75 prisoners. What was actually being studied was the effects of Agent Orange on humans. Prisoners were injected with dioxin, a toxic byproduct of Agent Orange, 468 times the amount the study originally called for. The results were prisoners developing severe acne combined with blackheads, cysts, and pustules on the face, armpits and groin. Long after the experiments ended, prisoners continued to suffer from the effects of the exposure. Dr. Kligman went on to become the doctor behind Retin-A, a major treatment for acne. We hope you find this video informative. Please subscribe and like for more interesting videos. Thank you for watching.